There's a gap to be closed, and the African American Male Wellness Agency is standing in that gap, providing solutions to extend life expectancy in our community. We know that the Black men die, on average, 12 years earlier than their white counterparts. Black men are dying, and they don't have to. Each year, the African American Male Wellness Agency, with a footprint in over 20 cities across the country, provides free health screenings. While it's advertised as a 5K walk, it's really a carrot to get Black men checked out so they can know their numbers.
So we like to think about the walk as the most fun that you'll ever have at a doctor's appointment. Men are coming, they're getting a health screening, they're having a good time, but they leave with the next steps knowing what to do to increase their life expectancy.
Black men are 3 times more likely to screen positive for heart disease than white Americans. Colon cancer shows up at a rate 20% higher and kills Black Americans at a rate 40% higher than white Americans. The free health screenings that we give out at our events help the Black men in our community with early detection and raises the awareness for the need of preventative care.
My name is Kenneth Ray Van Pelt. I go by all of it. My story and the backdrop of my story is in 2007 at a community event that one of the neighborhood nurses gave me a blood pressure test, and the blood pressure was so high she told me to go to the hospital immediately. It wasn't really bothering me then. I worked through the whole festival, but when the festival was over, my head started hurting real bad. Stopped at the fire station on my way home, and they gave me some nitroglycerin to put under my tongue and told me to go directly to the hospital. When I went to the hospital, they put me in the hospital immediately. I received my kidney in 2009. It's been almost 14 years now since I've had this kidney, and if it wasn't for a dear friend, I could have passed out or died on the way home just from having my blood pressure that high.
The work done by the African American Male Wellness Agency is data-driven. Black Americans account for only 5% of participants in clinical research trials. Black Americans' mistrust of medical researchers and the healthcare system stems from historical systemic racism spanning back for centuries. That includes the access to healthcare, health insurance, as well as negative encounters with the healthcare professionals. The African American Male Wellness Agency launched a research initiative under which we did a clinical study in a partnership with Ohio State Wexner Medical Center called Black Impact 100. Due to the reputation and trust built in the community, the agency was able to attract enough Black men to conduct a successful study. The Black Impact Pilot was established in 2022 to the National Library of Medicine and studied improving cardiovascular health in Black men through a 24-week, community-based, team-based lifestyle change intervention.
If you hadn't had that free health screening, what would have happened?
If I hadn't had that free health screening, I could have possibly died on the way home from not paying any attention, thinking it's a headache and an Advil or Tylenol or something would have took it away. I would have never knew I had high blood pressure, would have never knew it ran in the family. This walk is important to me from several factors, not only the free health screening, but also having a screening, a PSA screening for cancer. Found out I had cancer, and now I've been cancer-free for 3 years.
It's more than a walk. Real men, real talk. Black men are talking. Mental health is a big issue in the Black community. Only 2% of psychiatrists and 4% of psychologists in the United States identify as Black, making it a challenge for the 13% of Americans who identify as Black to find someone who looks similar to them for their mental health care.
We refer to it as mental wellness and not mental health because we wanted to establish an ongoing series of well-being. It's something that we want to do long-term as it pertains to taking care of not only ourselves, but the generations to come behind us and setting the example of what the community should look like.
Black American adults are 20% more likely to experience serious mental health problems. And Black young adults between the ages of 18 to 25 experience higher rates of mental health problems and lower rates of mental health services compared to their white counterparts. With the African American Male Wellness Agency, we're taking our mental wellness into our own hands. With our Real Men, Real Talk program, men are talking across the country. In Columbus, Cleveland, Charlotte, Houston, Atlanta, Memphis, Louisville, Los Angeles, and more.
As a community, we have everything that we need to heal ourselves.
So in order to be around, you got to do something. And if you don't do something, you might not be around.
The incidence of women dying for breast cancer has gone down, but not for our Black women. At the African American Male Wellness Agency, we are concerned with the wellness of the Black men and their family. We know that the heart disease kills nearly 50,000 women annually. Heart failure is a major public health problem that has increased most dramatically in young Black American men and women. More than 50% of Black women in America have hypertension, compared to only 39% of white women. With Uplift Her, the African American Male Wellness Agency is taking the initiatives to make sure that Black women have access to health screenings. The agency wants to ensure that Black women are healthy by offering biometric screenings, free mammograms, free cancer assessments, and information about lung health, heart health, diabetes health, maternal and infant health, mental wellness, and much more.
My wife beats me up about the hospital all the time and doctors. You got to make this appointment. You got to do this. You got to do that. You got to get to the dentist. You got to do that. So, I'm trying to take care of all those things to have a healthy life.
Healthy men make healthy families. That's why it's important for Black men to be in their children's lives. The African American Male Wellness Agency knows that strong communities are made up of strong families, and strong families have active fathers. And so we launched the Fatherhood Initiative.
For fathers, it's important for them to have their needs met so they can meet the needs of their families. We have several programs and activities that we host in an effort to engage our fathers on a more consistent basis.
73% of Black kids are not kindergarten ready. So we created the Proud Dad Pledge to get fathers engaged and active in their kids' lives. For fathers, it's important for them to have their needs met so they can meet the needs for their family. We have monthly programs and activities to build community and fellowship for Black dads. We do an annual Proud Dad Cookout, celebrating and centering fatherhood. We have Cooking with Dads, which is an interactive cooking experience that serves over 700 dads every year and helps them instill a wellness lifestyle for their kids.
Just thinking about the added years, just makes my heart almost want to burst because, when you think about it, the years that were added back to my life, I'm over 13 years now, going on 14 years. And that's 14 years of being able to see my grandkids grow up, still be here to see my mother, and not be the first one in the ground. It's 5 kids in our family, and we're all in our 70s and 80s, and we're still here with my mom to this day. So, it's just a blessing to still be here.
This is more than a walk. All of this is about making sure that Black men and their families live longer. We are saving Black men's lives by allowing the clinic to come to the community.
They need to take these things serious.
There's a gap to be closed, and the African American Male Wellness Agency is standing in that gap.